If you distill the fundamental idea of healthcare down to its purest, most unadulterated form, the essence of it just seems so simple. When someone is sick, they should get the care that they need. And this should be true for all of us humans living right now, forever on the cutting edge of the future, riding around on this blue and green orb through the universe and living our shared history as a species. But there's a heartbreaking reality to healthcare, and cancer in particular. The messy and upsetting truth is that the number of people who can get the best care, if we can even agree on what that means, which we can't, is fractional. Untold numbers of people can't even get decent care, and millions of people get absolutely no care at all. So why is that? There are glaring, enormous problems plaguing medicine and medical systems around the world. How do we unwind them? How do we even understand them? And for all the individuals in the world with cancer who are struggling, how can we bring them within reach? Can we create actionable solutions that alter the course of their disease and of their lives? It's a lofty goal, but it's the one we're going to tackle right here. I'm Evan Young, and this is Within Reach from Avalier Health. Patrick Meehan was taking a shower when he noticed something suspicious on his penis. No handsome 31-year-old red-headed Brit would have been thinking about cancer as their first reaction to seeing a rash, but he did get it checked out by the doctor, who prescribed him a steroid cream and sent him on his way. But a lump developed under his foreskin. It was sensitive during sex, but still, he didn't think much of it. And he stuck to the cream for the next 8 months. It wasn't until a bathroom break in the middle of a Fatboy Slim concert that he noticed blood, and started to think that something more serious might be at hand. But still, it was summer. He was young, he was busy, and when his father passed suddenly, he was also grieving. So he put it off. But 9 months after he first noticed that rash, he did go for more consultation. Even at this point, however, it still wasn't cancer at the top of his mind. The lump was biopsied and tested, and then, 2 weeks later, his world changed. Patrick was blindsided by a diagnosis of penile cancer. Like many, many people, Patrick had very little awareness that cancer of the penis even existed. So as we consider Patrick's story, taboo cancers, which include not only penile cancer, but also many other stigmatized diseases, including anal cancer, rectal cancer, lung cancer, and more, was the topic of discussion when I sat down with Rebecca Porta, CEO of the Urology Foundation, and Pip Humphry, Associate Creative Director at Avalier Health. We talked about the dangers that come with cancer when stigma is involved, the embarrassment and the fear that people have, and the ways in which delays in seeking treatment can impact survival. That's coming up now on Within Reach. Pip, Rebecca, thank you so much for joining me on the show today. I'm really excited to talk about cancers that are, by their definition, hard to talk about. So I'm expecting that this is going to be a challenging conversation. We've been referring to them, I think, here at the show as taboo cancers. And that's a little bit of an easy word. It's a little bit more accessible for us as shorthand. But the reality here is that this is a collection of cancer types that we're going to talk about today, including penile cancer, anal cancer, rectal cancer, and others. And they exist in that broader category of stigmatized cancers. They're well-defined, they're well-discussed in the medical literature. So I do think at first it would be important to dive into stigma and define it, not just in a broadly social sense, but through the oncology-specific lens by which we tend to discuss things here on Within Reach. So, Rebecca, this is for you first. What are those types of stigma that are in play with these cancers?
So penile cancer is a rare cancer. Just under 800 men are diagnosed in the UK with the cancer every year. And globally, it's about 37,000 men will be diagnosed. But we believe it's probably a lot more than that, actually, Evan. I think the stigma associated with this is connected to location, first of all. I think people don't talk about penile cancer in the same way that they would talk about prostate and testicular cancer, which have got much greater awareness. There's a lot of embarrassment about it. People make a lot of assumptions about this particular cancer and what might be the risk factor or what might have, for want of a better word, triggered the cancer. And I think even just the fact that so few people have heard about it, know signs and symptoms, it's just not talked about in the same way that Other cancers are talked about. When you look at something like breast cancer, we all know what breast cancer is. We're very open to discuss the signs, the symptoms, to talk about checks, but we're a long way off that with something like penile cancer. So a lot of embarrassment, a lot of fear as well for people who believe that they might have a sign or a symptom or might be going through the process of being diagnosed. So a lot is attached to that stigma.
You mentioned location, but just to clarify, you mean location on the body, not geographical specificity, no?
No, penile cancer is cancer of the penis. So it will be a tumor somewhere on the penis that has been identified or within the penis.
Got it. So you mentioned location, embarrassment, some assumptions that people may make, some fear they may have. I want to dig into embarrassment a little bit first. When we think about embarrassment, is that you don't want a healthcare provider potentially poking around? Is it, I don't want to have to turn and tell my friends or loved ones about this? What kinds of embarrassment are we talking about?
I think it's all of those things which you touch on. So first of all, it's embarrassment about the location because men don't often talk about their penis in a health scenario. So they might make a joke about it, have a name for it, etc., but they're not talking about it from a sort of a health perspective. There is that embarrassment of going to a healthcare professional. And we know that there still exists some wariness, some fears amongst men about seeking help from a healthcare professional. We know that that is a barrier to many men to make that first call or make that first appointment and have that discussion. There's a lot of embarrassment and fear in terms of friends and partners. So I have known many, many penile cancer patients and consultants who said that they went for months ignoring the signs and symptoms until their cancer was quite advanced. I can remember being at one particular hospital in Scotland where there is a higher than average incidence of penile cancer than elsewhere in the UK. And the consultants and some of the nurses there were telling me that you would have men who had gone for months with signs and symptoms. And in some cases, they would come to the clinic. You could smell that there was a discharge there. And they talked about the penis actually being eaten away with cancer, which is really scary, really frightening. But it's that fear of going to see a healthcare professional. In many cases, those men were sleeping in separate rooms to their partners. So there is that real fear of partners, friends, healthcare professionals. And then you obviously, once you have a diagnosis, you're going through the whole routine of actually maybe renewing your mortgage or renewing a life insurance policy, and to say that you've got penile cancer and the person at the end of the phone saying, oh, sorry, what was that? That again is really embarrassing. So it is a really tough cancer to deal with. I've worked with men and their families for many, many years, and it is really hard. It's very hard to listen not only to their experience, but also to their post care, when they've been given the all clear, just what they have to go through as well. And some of the treatments can leave all sorts of issues for men as well, which we might talk about later on. But I think it's a really tough cancer to deal with. It has nowhere near the support. And I think the companionship that we see when someone is diagnosed with breast cancer, women do come together, families do come together, and we're a long way off that with penile cancer.
So, Pip, what do you think? And when we think about fear and embarrassment at the outset, anything to add there?
Yeah, so my husband was diagnosed with penile cancer over 4 years ago. And I still really clearly remember that moment where we got the diagnosis and we were sat there with neurologist. And we were just like, how have we never heard of penile cancer? Of course you can get cancer on your penis. It's just another part of your body. Yet it's never heard of. Like, I've worked in health for nearly 20 years, and I've worked on all sorts of rare diseases. And never have I come across even the term penile cancer. And I just found it incredibly bizarre. There was the shock of the diagnosis of cancer, but also the shock of being diagnosed with a cancer that I'd never heard of, but involves one of the main body parts. And like Rebecca says, it is a rare cancer. So it's not a cancer that most GPs will ever come across, but it is still a cancer that exists. It's on the rise and no one seems to know about it. So for me and my husband, Dan, when we got that diagnosis, it was just like, how have we not heard of this? And like Rebecca says, we experienced similar issues in telling people. Just inherently, we're a bit kind of like, yeah, he's got cancer. Oh, it's penile cancer. Rather than he's got penile cancer and expecting people to almost just take that in their stride, we kind of preempted that there'd be some kind of different reaction because you have that reaction as well because you've never heard of it. And it involves that body part, the manhood, if you like. And one of the things I also really remember from that early stage, friends and family, everyone was very supportive. I remember telling someone who wasn't in our friend family group, I was probably at like a beauty appointment or something. The lady was like, oh, how are things? And I said, oh, well, not great at the moment. My husband's being diagnosed with penile cancer. And she was like, oh, that's so embarrassing for him. And I was like, is it embarrassing? Like, that is not any other cancer. Do you get that kind of reaction? My back was immediately up because I was like, it is not embarrassing to have cancer wherever you get it on your body. But that, in a nutshell, for me, kind of summarized that invisible barrier to getting diagnosed with penile cancer and telling people you are going to have to deal with some people reacting like that because it's just not something people are comfortable with yet.
Yeah. So, like you, I've been working in healthcare communications in some capacity for more than 20 years. I actually do remember my very first job in the business. I was a young editorial assistant working at a publishing company, and I was sort of forced to look through textbooks that had photos in them to figure out which photos that we could use to accompany some of the stories. And there was a section on penile cancer, and I remember looking at some of the images and just thinking to myself, of course, I'm not in the shoes of anybody that has it, but I can't possibly imagine waiting and not going to the doctor if I were experiencing something like what I saw in those images. You know, as a man, as I'm sure you've heard from any other man that you've talked to, it's such an important part of your identity and your anatomy for all kinds of reasons, not just health, but psychological ones too, right? It's a prized possession. It's just the idea of waiting is a really interesting one to dig into. So with your husband, do you believe that you all delayed in seeking out care, or were you like, you know what, we are right into the doc?
So I still remember Dan saying, there's something on my penis that I'm not happy about. And then he almost like really shyly showed me it. And my immediate reaction was like, ow, that looks sore. I was like, you definitely need to get that checked. But we were just coming out of that COVID era, and the way you dealt when you had consultations with GPs was still quite predominantly remote. So his first appointment with the GP was a remote consultation. And he talked the doctor through his symptoms, explained what it looked like. The doctor asked him some questions. But that whole consultation, he wasn't able to show his penis. So the GP actually said, I'll have to end this consultation if you get your penis out on camera. So at that first consultation, there was no way for a doctor to actually see what Dan could see, which was really bizarre. So without even seeing it, that GP prescribed a cream, said, try this for a couple of weeks, and then maybe go to a sexual health clinic if it doesn't clear up.
I hadn't even considered that there are telehealth ramifications. So since then, have there been some provisions that have been developed that you know of that a telehealth appointment actually could include actually taking a look at what's going on?
I really don't know. Obviously, the further we've moved from COVID, the more in-person appointments you can get again. So the environment's shifted. But it's a good question. I don't know whether it has changed because there's all sorts of policies and internet violations, etc. But for an intimate body part to be having that discussion remotely, you need some kind of facility to have it looked at. It was also strange that GP didn't suggest we go and see someone in person because he couldn't look at it, rather than wait 2 weeks, which with Dan's type of cancer, he had a really aggressive type. You can't wait weeks with these types of cancers. You're talking like a massive swing in projection in terms of outlook for the disease.
So, Rebecca, you had talked about fear. I think you've both talked about fear. Is fear, do you believe, because hey, this may lead to a rearrangement of what I believe my identity is? Or is it a simple and different fear of, if this is an STD, for example, I don't want to face that? Or is it some other kind of basis for what the fear may be?
I think it's a combination of things. I think, as Pippa's sort of already referred to, something's not right. What could that be? What might it involve? If it's an STD, where's that from? What treatment's going to be needed? Who are my partners, etc.? So there is obviously that fear. If it is cancer, something that needs further investigation, there is still that fear for many people about cancer. We know that penile cancer is certainly on the increase, but it predominantly does affect men in their 50s, 60s, 70 plus. So you still have a sort of an age group who might have a concern about going to the GP or feel less comfortable going and speaking to a healthcare professional. So I think it's a combination of all of those factors that come to play.
So I mentioned something a second ago, and I think it's worth also exploring a little bit. I feel like embarrassment is one thing and fear, not to say that they're unimportant, but when I think about one thing that might be in play for me personally, if I had issues, if I thought there was something going on, and if I were diagnosed with penile cancer, it would be, this is now a part of my new identity that I have to attempt to go explain to the world. And I am no longer necessarily me. I am now Evan, a guy that has penile cancer. So do you believe that there's something fundamental about the reshaping of your identity that is driving what that feeling of embarrassment may be?
I think that's a really good question. I would say that the patients that I have worked with, spoken to, need in their own way to come to terms with their cancer diagnosis. And I think everybody does. When you have a diagnosis of cancer, it changes your world. Whether you have a fantastic support mechanism around you and it's a cancer that's very well known, recognized, etc., or whether it's a rare cancer, you've got to come to terms with that diagnosis and how you're going to manage, how you're going to sort of tell family, friends, etc. So I think that is a really key thing to look at. I think for men who have either a full or a partial penectomy, again, they've got to find their comfort zone. Do they go and tell everybody around them quite openly what they've gone through? Do they tell new sexual partners, if that's the case, that they've had penile cancer? And I've known both sorts of men and those who sort of fall somewhere in the middle. So those who just shy away from it, they want to keep it within their family, they don't want to talk about it, they want to get on with their life. And those who are very, very open and want to talk about their experience, want to talk to the media, want to share their story, and actually use it as a platform to promote awareness of the disease and signs and symptoms, particularly, I think, younger men as well. So it's really where you find your sort of level of comfort in terms of talking about it and dealing with the diagnosis. I have also known a couple of men who were quite open about it and then took a big step back because they realized they had younger children and they weren't comfortable with that setting of children in the classroom talking to their children about, daddy's got cancer, etc. So the one thing we always say is that person has got to come to terms with their diagnosis, their treatment, their outcome, their prognosis, longer term, etc. And that takes time.
Pip, you had said that with you and your husband that you didn't have any awareness, at least initially, of the fact of penile cancer being a thing. Mm. Now, it also sounds like, Rebecca, as you're saying, that everybody comes to terms with what their own path or journey is going to be and how they communicate it. What could we be doing to raise some broader awareness, understanding that some percentage of men are just not going to be willing to share their stories? Is that awareness more HCP focused? Is there some broader public awareness that we could be doing? Do we need to be targeting GPs differently about what signs and symptoms may be when a patient presents?
It's everyone. It's from patients to the general public, to GPs, to sexual health clinics, to dermatologists, to urologists. The journey is fragmented. When you get on the right path, it's really good. But getting that initial diagnosis is actually really tricky still. So there's a huge amount of education that needs to be done with the GPs, but also We just recently did the Name It campaign earlier this year, where we went kind of loud and proud with nicknames that men have for their penis to engage men on a humorous level, because we know that's where they're comfortable. They're comfortable talking about their penis in a jokey way, that when it comes to something serious, it's a whole different matter. So the Name It campaign was really leaning into that to start to get that conversation going. And it had an amazing, amazing impact. The reach we achieved with that campaign has been incredible. And it's really important that people know the term, because I think if you know that you can get cancer on your penis, it means that when you notice something's wrong, you know it actually can be something really significant. So you need to treat it as if it could be something significant and get it seen straight away. It's not necessarily a sexual health related thing. So the more people get that into their vocabulary and know that it's a part of your body you can get cancer, the more people are going to be aware and cognizant if something shows up to do something. But then you also need to close that gap with the GPs, so that when you have that initial consultation, if the GP is not sure, or if they can't rule out the fact it's penile cancer, that they keep it ruled in. So I think because a lot of these GPs will never come across penile cancer, it's just not considered, whereas it needs to be. If something is presenting on the penis in an abnormal way, unless you can rule it out, it needs to be ruled in. And Rebecca probably experiences a lot of this in her work, is the more GPs that we can get familiar with the signs and symptoms and aware that it's on the rise and know what to do if they don't know what to do, like who to refer on to, not just prescribe a cream and see what happens next, the more people that are actually going to get helped earlier. And also, the more people that are helped earlier, the more positive stories we'll start hearing in the media, etc. More case studies we'll hear of positive outcomes. And all of a sudden, penile cancer isn't as scary. Because when Dan was diagnosed, you immediately go to Google, what is penile cancer? And I'll be honest, there are only really scary stories because it's only the extreme that you hear of. So there's still a huge amount to do to kind of connect all those dots. And you've got to raise the awareness in the public so that people can self-check. But you've also got to raise that awareness of what to be looking for, how to refer, where to pass on to when you're on the healthcare side of it as well.
Yeah, I did see that campaign. I was really interested, by the way, just as an aside, to learn what the data are around how many men have nicknames. I am not one of them, but that was interesting. I'm sure he had a lot of fun figuring out what all the potential nicknames were.
Maybe it's a British thing, but I have a sneaky suspicion that it's a bit more universal than that.
Yeah, for sure.
We did a survey, because as you do when we were looking into a hook, a kind of nugget from which to communicate about penile cancer, we found this survey of people admitting that they had nicknames. But we're like, it was quite a high number. We're like, are we sure it's that many people? It was 80% of men admitting to having a nickname for their penis. For us, that was like, right, this is how we start to talk about it. This is something they are talking about. So let's lean into that.
Well, I do think you've uncovered a truth there that is an important one. And that's, as if it needs saying, this is an incredibly important part of a man's identity. And you might argue it is the most important part, right? So maybe there's something to do there with that direct correlation between anything that seems to be going wrong and the fear of understanding that something really may be wrong here and that you have to get it checked out. Also, as a different kind of aside, I don't know the data here, but how many penile cancers do we know, roughly speaking, as a percentage are HPV based in origin?
There is a high percentage of cases where HPV is linked to penile cancer. The other risk factors are things like smoking, phimosis, where it's very difficult to pull the foreskin back, but certainly HPV is high on the list.
Is there a lower incidence of penile cancer in men who've been circumcised than?
Yes.
Okay.
Yeah. Much.
Yeah. Interesting.
Yeah.
Oh, so it's significantly lower.
Significantly so, yeah.
Well, that makes even more sense, I guess, for me to be talking about this with some folks from the UK. I'm pretty sure that the circumcision rates in the US versus some other countries abroad are very different, right? I have another question here about some of those things that drive some of the hesitation, just being sexual in nature, right? Is that another part of it? Is what's driving the fear too? Like, I don't want to find out, not that just some portion of my penis is going to have to be removed, but it's going to have an impact on my sexual life, my sexual health. And I don't want to have to face what that impact is either. So, along with that, I'm also curious, Pitt, too, with your experience, was that a question that, as you told people, that anybody would ask you about? Friends, family? I mean, would people go there and try to figure that out with you?
No one ever explicitly asked, but you always sense a kind of almost morbid curiosity about it. Because again, that it's extremes, and what you read when you go into Google is the extreme, but not all cases go that far. And actually, the important message is that if we can get people to acknowledge this sooner and get into the right care pathway sooner, those extreme responses and more severe treatments are not as common or not as necessary. I would definitely say on a personal level, there's interest, but I think people don't know how to ask. They want to know, they don't know how to ask. But also, is it important? It's just this element that's on your penis. Like, no one treats breast cancer in the same way anymore. So it's an interesting one to observe, because you definitely sense people want to ask or want to know, but they don't.
Are there some support systems that are in place for men who are experiencing this that are more fundamentally sex support as opposed to a broader either treatment support or diagnosis support? Do we offer men who are going through penile cancer, like, hey, and this is how it may impact your sex life?
I suppose it depends where you're at. I mean, at the end of the day, you're being diagnosed with cancer, so your life's at risk. So what you're thinking, in that first NHS consultation, we had a Macmillan nurse there with us. So you know immediately this is something very, very serious. So your number one priority is to do whatever you need to do to save your life. And that's how we approached it. Whatever treatment necessary, we would take those steps to make sure that Dan was still here for his little girls.
So in England, we have 9 supra networks. So these are specialist centres which are key in the pathway for a patient. So earlier on, Pip talked about the GP referring to a sexual clinic, but actually what you ideally want is to be referred, if there is a suspicion of penile cancer, to one of these super networks. In the super networks, what you will have is a team of experts who will provide the care and the support that a patient needs. So that will be everything from deciding on the treatment pathway. Well, firstly, getting the diagnosis, looking at the treatment pathway and the treatment options, and then looking at the aftercare and support that's needed. Within the team, there will be very often psychosexual support in place for the patient, or that can be requested. But the whole team is set up to really provide that full support that a patient will be needing. And actually, one of the things that was so important when these super networks were set up many years ago, so the recommendation was to set up these specialist centres to treat men, was to ensure that you had surgeons who were used to treating men with penile cancer, because preservation of the organ is absolutely key wherever possible. Providing the aftercare, providing the psychosexual support, that also is key. Having a nurse at the end of the phone able to answer any questions and concerns, that's really key. So there is really good support within the centre, but also what you'll have right across the UK are centres and support networks which are available for men and their families. And they can range from organisations that provide sort of Facebook groups right the way through to sort of drop-in centres that can talk about cancer generally, look at sort of holistic care, etc. We like to say sort of a cup of tea and sympathy, and something like a Maggie's Center, as well as really good quality information and support. So there is some really good support out there actually for men and for their partners. But again, it's finding the right time maybe to seek that support. So it might not happen straight after surgery. It might be 6 months, a year, 2, 3 years afterwards. But it's just knowing that support network is there, which is really key.
Rebecca, do you know if there's a push to recruit specifically males into that support structure so that they have male voices to consult with or lean on as they're going through their treatment or, as follow-ups, however long that support needs to exist for? Because I could imagine if you're still having conversations or you've got like nurse care, for example, on the phone and it's a woman, there may be some lingering, like this person may not understand really what I'm going through.
It's a good question. I can remember one of the first consultants I ever met saying to me, Rebecca, you will find that I will be running a clinic. It's a room full of men who are all there post or prior to their penile cancer surgery. They all know what they're in there to be treated for or what follow-up care they're getting, and they won't talk to each other. That doesn't happen in a breast cancer clinic. You will have women who become lifelong friends. So there is definitely a move to encourage people to seek support, seek professional help, seek friendships, whether that is, as I said, 6 months after your treatment, a year after, etc. Because I think once you've had your treatment, you may just feel, well, actually, and this is very dependent on your cancer treatment, how advanced your cancer was. So it may be that you come away and you don't feel you need the support. It may be that you do feel you need some practical support, some emotional, mental health support, etc. So there certainly is a drive to encourage men to seek support, particularly if they are feeling a little bit lost after their treatment. But then again, as I said, not every male will need that support.
You are saying something that's really interesting, I think, that just clicked for me. And that's there is something embedded, broadly speaking, in the male psychology here that is the problem, that's in the way, right? I don't know if I could tell you what that is. I can make some assumptions about male macho thoughts, behavior, whatever it may be. But do you believe that's the case? I mean, Pip, again, having gone through it firsthand, was there some part of just this fundamental maleness that got in the way of anything?
Yeah. And it's strange because it's just inherent, just from that very early moment where he showed me his penis, in terms of, I think there's something not right here, is very different to if there was something on his leg or his arm. He was not reluctant to show me, but a bit embarrassed to show me, because the penis is known as the sexual organ. It's very deep rooted in terms of like a symbol of masculinity. It is your manhood. And I think it's really hard for a man to be open about the fact there might be something wrong with it. I think it's a really scary thing, because you also know that something you normally keep private is then going to be investigated by a number of people. And on our journey, it's a lot of women as well, especially at that sexual health clinic. I think Dan had like a whole hive of women coming in and having a look and saying, yeah, we don't know what it is, but we know it's not right. So you have to very quickly get comfortable with the fact it's on your penis. There is that initial barrier, and it's such a shame it's there, because I think for some people that is delaying them getting the help they need, and that is what's costing them more severe surgery or actually their life. Like with Dan, if we'd stayed on the NHS route and just had a small biopsy and then waited 6 weeks, his prognosis would be really, really different because of how aggressive his type of cancer was. So you just can't wait.
So is that ultimately the greatest problem for us to be solving then? And that's foreshortening the time that it takes in going to get yourself checked out, because ultimately that's going to get you to a diagnosis faster? Or is it once you've already been checked out, there's suspicion, is there a different kind of length of time that we need to compress?
It's a bit of both, isn't it? I think different men, maybe different generations, will react at different speeds. So for Dan, we immediately scheduled a GP appointment. But the problem we faced was then that GP not having the knowledge or awareness that it could be something more severe. I mean, he actually didn't have a complete picture, did he, in many senses of the word? And what he should have done then is, instead of just say, try this cream and wait, he should have made sure that someone was seeing that. So I think there's lots of points where there's gaps. But for us, there were actually a lot of points where it came together and we were super fortunate. And once, the sexual health clinic flagged it might not be right, we were lucky enough to have private healthcare and go to a specialist dermatologist who then was immediately like, I'm pretty sure this is cancer. I'm going to refer you to Mr. Manier, one of the top urologists in the UK and probably beyond as well. And actually, when we went to Mr. Manier, initially there was an 8-week wait. But because of how joined up the care is, and when you're in that pathway of a rare disease as well, he managed to reschedule and we got to see him that next week. And then his actions then were life-saving for Dan. He took immediate action. He didn't sample and then see what happens. He took the area that was affected and made sure there was margins and all of that kind of thing, so that when the results came back, even though it was cancer, we knew that the majority of it had been taken. So there is unfortunately still an element of luck, but in the UK, when you get to the right people, the people that know about penile cancer and that are connected, like, it's fantastic. You almost felt like you're getting VIP treatment, but getting there is still tricky.
So I think Pip and what she has described has been really interesting. Mr. Manier is seen as an absolutely top specialist in this field. And Pip and I both know Mr. Manier, and he introduced us initially. So here in England, what would happen is that you would go to see your GP to present with a symptom or symptoms that you were unsure of. You might be given a sort of topical cream. So the GP might believe that it's something like a skin condition, like an eczema, psoriasis. You might be given a topical treatment. If that doesn't clear up within 2 weeks, you must go back and see your GP and ask for a referral. The referral will normally be to a urology department, or in an ideal scenario, you are referred straight to one of the penile super network, of which there are 9 in England. And then you would be biopsy checked, investigated. You'd go through the sort of whole pathway to ensure that you had a diagnosis and that a treatment pathway was set up for you very quickly and you'd begin your treatment. So as Pip has rightly said, getting that treatment started once you have a diagnosis is absolutely key. In Dan's case, as Pip has said, it was advanced. Other people, it may be slightly more slow growing, but you definitely want to get on that pathway. And it's really key that we get GPs as well as the public to understand the need to get onto that right pathway really quickly. Time is absolutely crucial, as we know, in this particular cancer.
So is the Urology Foundation engaged in any capacity on trying to influence either some of the systemic or the structural apparatus that exists to get men through their pathway, either more expeditiously or more effectively, whatever the case may be there?
So the Urology Foundation, we recognize that the current pathway for men is excellent. So the aim is that if there is a suspicion of cancer, you get on the right pathway really quickly. The challenge we've got, which Pip has referred to, is that most GPs will only ever see one case of penile cancer, if at all, during their career. So what we need to do as a patient organization, along with other charities and other organizations who have an interest in highlighting this disease, is to get GPs to understand that if something doesn't look right, that they shouldn't then give the patient the opportunity to sort of come back and give them another treatment cream, another topical cream, etc. What the GP needs to do is actually try the course of treatment. If that doesn't work, then they need to be referred really quickly. This is not a cancer which you should be delaying in terms of looking at a treatment and thinking, well, I'll try a different topical cream, etc., they need to get the referral done really quickly. The actual pathway is excellent. It's a well-established pathway. It provides great care for men and for their partners as well.
So it's less about the pathway. It's more getting them into the pathway as fast as we can.
Getting them on the right pathway really quickly is absolutely key.
Got it. So we've been talking almost exclusively about penile cancer here, which is great. I think it's an important topic. Have you learned anything from some of the other stigma-associated cancers that I mentioned at the top, whether that's anal cancer, maybe testicular cancer, lung cancer was a pretty well-known stigmatized cancer. So have you learned anything? Have you seen, hey, in this cancer type, this is what they do, and we might be able to take a page out of that playbook for penile cancer?
So I've worked in the male cancer space for just under 20 years. And I've learned a lot and been very humbled by hearing some of the experiences of men and their partners during that time. So for me, what I've seen during that time is that younger men are far more comfortable with going to see the GP or speaking to a healthcare professional, or in fact speaking to a friend, family member, colleague, etc. And that's absolutely key. I think when I first started to work in the male cancer field, there were far too many cases where embarrassment really was causing the death of so many patients. And that was very, very hard and very sad to see. I think awareness and talking openly is really key. I think high profile individuals, celebrities coming out, talking about their experience, sending positive messages is really key. And that happens a lot more now. When you think about the prostate cancer movement that has happened here in the UK over the last few years, that's really key. Men are really coming out and helping to push and wanting to drive change. I think we still have a long way to go to catch up with the sort of, I suppose, the breast cancer space. But I think we've made enormous leaps and bounds in the last 20 years. And for me, I think the really key thing is people being open and aware, not being embarrassed to talk about their cancer or their signs and symptoms, or actually the life after cancer. Survivorship is really key. So some men who have had a full penectomy, for example, really struggle when they urinate. They talk about the spray. And I think those men are now talking openly about that, whereas 20 years ago, they'd sort of say to me in a quiet corner, Rebecca, this is the impact that I've been left with my penile cancer. It's affected my relationship, etc. Whereas now I think men are much more open about talking about things. So I think generally now it's that openness and the awareness that is really great to see, and people sharing their stories, and that sense of camaraderie that we're seeing and companionship that we're seeing. So men posting messages of support when another man is diagnosed. And I think that's really important, that sense of friendship and companionship and support for people going through their cancer journey or who are survivors is really key.
I think the only way you overcome stigma about anything is by talking about it and showing a spread of people affected by it as well. I think that's one of the challenges with penile cancer, is for it not to be sensationalized. And actually, it's a very treatable cancer if caught early. And I think, you mentioned lung cancer historically being stigmatized by those who smoked. But the more we showcase patients that have overcome lung cancer or have experienced lung cancer through absolutely no action that they've taken, it's just happened to them, the more we move away from thinking this is because of that and make any kind of judgment in between. So stigma only exists because people don't know. It comes from a lack of understanding. So the more we can do to raise that level of awareness and understanding, just naturally that level of stigmatism will come down.
Okay, so as we wrap up, I'm going to ask both of you a slightly different version of the same question. So if we could wave a magic wand pun intended, in this case, going back to your campaign. If we could wave a magic wand, Pip, what one thing would you want every man to know? Just broad awareness. What is that one message that you really would like every man to understand?
Just that you can get cancer on your penis. It's as simple as that. Knowing you can get cancer there, I think, changes how you view anything that you notice there. And you should be just as vigilant about changes on your penis as you are your prostate, your testicles. For women, we're constantly told to be checking our breasts from really early age now. So again, for a man, for their penis, they should be encouraged to be checking that regularly and just checking generally for its health. So yeah, I just want people to know that penile cancer is a thing and just be vigilant.
So Rebecca, the question for you is a little bit more geared toward an HCP. In the healthcare provider realm, is there one really important thing that you just want everybody on that care pathway, but starting, I think, more toward the beginning of it, to understand about penile cancer?
My message would be, if a patient presents with something that doesn't look or feel right, so that it may be a rash, it may be a growth, it may be a discharge, swelling, or some discomfort in the groin area, don't assume that it is a STD. Don't assume that it is dermatology and send them to a dermatology department. The sooner you act and consider this could be an early sign of penile cancer, the better the chance and the outcome for the patient. So think before you make an assumption about what this could possibly be.
Well, Rebecca and Pip, on behalf of all men, honestly, thank you. I mean, the work that you're doing and really your commitment to that, I think on behalf of male health is commendable and excellent. And thank you, of course, too, for coming onto the show. It's a challenging conversation, but it's one that clearly I think matters. So thank you again.
Thank you.
Thank you, Evan. Really appreciate it.
So let's get back to Patrick. Patrick was fortunate. Despite going 9 months between when his symptoms first appeared and his diagnosis, his cancer was successfully treated. He did need surgery, a glands resurfacing, which is the removal of the glands of the penis and a regrafting of skin onto it, which, of course, sounds incredibly frightening and painful. He received counseling, which he says was a huge help to him in processing what had happened and allowing him a better recovery. And he says the sexual side of his recovery was challenging. Physically, he was fine with his sexual function, but mentally it was a challenge. Yet he was able to navigate it with the help of his partner who supported him. And now, or should I say, right here, right now, he plays in his band, and in what I can only describe as a remarkable and rare amount of bravery for any man, he raises awareness for penile cancer by talking on stage about his experience. Thank you for joining me on Within Reach, a podcast hosted by me, Evan Young, and produced by Avalier Health with the help of Podcast Labs. For more Within Reach content, including in-depth reports about cutting-edge topics in oncology, patient stories, articles, and more, visit withinreach.avalierhealth.com. You'll also be able to meet our SenseMaker experts who have worked hard to bring Within Reach to life. To get in touch, email us at withinreach@avalierhealth.com or follow us on LinkedIn. And who is Avalier Health? Avalier Health is a global strategic partner for the healthcare industry, working across the breadth of the product lifecycle to ensure every patient is identified, treated, supported, and cared for equally. Our advisory, medical, and marketing teams come together powerfully and intentionally to forge unconventional connections, building a future where healthcare is not a barrier and no patient is left behind. If you'd like to support Within Reach, please leave a review on Apple Podcasts or wherever you get your podcasts. Your input helps us make the podcast even better, points us to topics that are relevant to you, and helps us reach new listeners. All you have to do is open up the podcast app on your phone, look for Within Reach, scroll down until you see it, write a review, and tell us what you think. Join me next time as we continue to uncover issues in oncology and work toward their solutions here on Within Reach from Avalier Health.